Welcome to Derm Power, where policy meets practice, hosted by the California Dermatology Advocacy Network. In each episode, we examine the legislative and regulatory forces shaping dermatologic care in California and what they mean for physicians and patients. Because protecting patient care means protecting the profession. Today's host is Dr. Ann Haas, CDAN President.
Hello, I'm Dr. Ann Haas, and you are listening to one of our scary story features on Derm Power, the podcast of the California Dermatology Advocacy Network. Periodically, we are made aware of some alarming stories from the non-dermatologic literature, and we feel that some of these are important enough to share with you. So this is the Scary Story Hour. This story comes from the U.S. Department of Health and Human Services, the CDC MMWR, which is the Morbidity and Mortality Weekly Report, and we will put that link up for you so that you can go and review the entire article. They've got kind of a cool graph there that you might want to look at. So this article deals with HIV transmission in 5 patients receiving PRP facials marketed as vampire facials at an unlicensed med spa in New Mexico in 2018. Now, this seems like a long time ago, but I will get to the part regarding why this is actually really important, even though this is now 2026. So this is a devastating story about 5 people who were infected with HIV at an illegally operated med spa in New Mexico in, as I said, 2018. So why we're going to talk about it now is because the investigation took many years to complete and was actually just published in 2024. This was the first documented blood-borne transmission of HIV from cosmetic injection services. Well, what happened? During the summer of 2018, the New Mexico Department of Health was made aware of a new HIV infection in a lady who was in her 40s, 50s with no known HIV risk factors. As it turned out, she had been to a med spa in the spring of the same year and received a platelet-rich plasma facial, or PRP facial, which was marketed as a vampire facial. PRP involves drawing a patient's blood from a vein and then separating it into its liquid and cellular components in a centrifuge. The liquid part then gets injected back into the skin for the purposes of skin rejuvenation and scar treatment. Clearly, it's important that this procedure is done under sterile conditions. So needles and tubes and gloves and sterilization equipment all has to be single use and not reused between patients, and that's the standard of care. The New Mexico Department of Public Health started investigating the med spa in the summer of 2018, and this case eventually came to involve the CDC. It was found that the med spa was operating without a license. It kept no records of any client. It didn't follow any sterile procedures, which is ultimately how the victims contracted HIV. This spa also operated in multiple locations. The investigative team had to look through client consent forms, handwritten notes, and telephone records to identify people who received PRP at this spa. They identified 5 patients, 4 women and 1 man. The man was the sexual partner of one of the women, and he had never received treatments at the spa. Through genetic testing of the blood samples, it was found that every victim was infected by the same strain of HIV, and that's how they determined that all of these individuals were infected from the same place. Now, these patients did not know they were infected. The spa certainly didn't tell them. Some of them found out when they went to get life insurance and had to do a physical. Others became sick on a trip overseas, and found out through a random blood draw. Only one person discovered that they were infected through their primary care doctor. And one person was hospitalized over 5 years after infection with an AIDS-defining illness. An AIDS-defining illness is an illness that you can only get if you have AIDS. So you can see that it took a long time after the PRP treatments to the time of diagnosis of HIV. And that's why this investigation took over 6 years to complete. And it was published a full 7 years from the time the first case was discovered. So what did the spa look like? Well, it was inspected, and the inspection showed multiple unsafe infection control practices. They found a centrifuge, a heating dry bath, and a rack of unlabeled tubes filled with blood. There were unlabeled tubes on a kitchen counter filled with blood as well, and lidocaine and Botox stored in a refrigerator next to food. There were unwrapped syringes found in drawers, on counters, and needles had been thrown out in regular trash cans. The law requires these sharp needles have to be disposed in a hard plastic sharp container, a special container for these, and then taken to a special facility that processes biohazard wastes. This spa had no autoclave to sterilize reusable equipment, so they couldn't sterilize anything even if they wanted to. And the spa cleaned their hyfricator tips with alcohol wipes and then reused them between different patients. You know, there are clinics in third world countries that are cleaner than this. This was just awful. This spa closed down in the fall of 2018. As it turns out, the spa was not just performing illegal PRP, but it was also performing illegal Botox injections and illegal microneedling. What made this case so challenging for investigators is that the spa kept no medical records. When you come to a clinic or a hospital, we must keep diligent and complete medical records of what we do because it's the law. These records are considered legal documents, and this is not optional. In this case, the spa kept nothing, and most of the patients who went to this spa were only Spanish speaking. So the investigators had to locate former clients using the owner's own telephone records, and then encourage the clients to get tested for HIV, and all this had to be done in Spanish. There was a notification ultimately sent out to practitioners in New Mexico to ask any patient with a new HIV diagnosis about any med spa treatments they might have received. There were also radio campaigns, social media campaigns, newspaper, television announcements done both in English and in Spanish. Now, this is the kind of tracking we see in an epidemic or during an outbreak. And that's how the CDC viewed what this med spa did. This med spa actually created an outbreak of HIV infection because of their illegal and unsanitary operations. And testing continues to be made available for any person who went to that med spa. The CDC recommended that it is important to determine new sources of HIV transmission, such as through medical spas that are operating below the standard of practice or simply illegally operating. It's really important that we need to require infection control practices at spa settings that offer cosmetic injection services to prevent the spread of HIV and other blood-borne pathogens like hepatitis B and C and others. And clearly, client records need to be maintained at all medical spas. And finally, consider this. Your tax dollars are paying for these enormous infection control measures because of one illegally operated med spa. But that's nothing in comparison to the life-changing diagnoses that these victims received. So, do it right, do it professionally. Thank you for listening, and stay tuned for our next scary story.
Derm Power is a production of the California Dermatology Advocacy Network. CDAN is a registered 501c6 organization representing the hardworking board-certified dermatologists in California. Thank you all for your amazing work. please make sure to follow CDAN on all our social media, Instagram, Facebook, YouTube, and LinkedIn, so that you never miss an episode of Derm Power. If today's episode sharpened your understanding of how policy impacts practice, then we invite you to join CDAN, especially if you are a board-certified or retired dermatologist. Learn more about our work at www.cadermadvocacy.org. Advocacy isn't optional, and CDAN is dedicated to protecting our patients and dermatologist-led care in California. See you next time.